Next, we will have Aysuda, received a PhD in political science from the University of Georgia Athens, USA in 2010. Her research interests include public opinion and discourses on redistribution, politics of new religiosities, and democratic backsliding. She is currently working on authoritarianization and civil resistance in Turkey. She coordinates the Threatened Scholars Integration Initiative at Bard College, Berlin.
Does this work? Okay, yeah. Hi, I would like to thank the organizers for inviting me and my colleagues. And I would like to not thank the British government for the very racist, incredibly ineffective, or I think intentionally ineffective visa process, where there's a brilliant, coming together of neoliberalism and racism. So, yeah. But anyway, risk communication, public health. So how dishonest policies erode public trust. I'm going to talk about something that we talked about in the morning, so it might sound a little redundant, but so we need to talk about the baseline risk. The risk of outcome for a patient under no treatment conditions. Without that, you can't understand what risk a disease brings or any kind of threat brings. So what happens if we do nothing? Do we have the same baseline risk for all communities and countries? Obviously, this is a rhetorical question. We don't. Variations in baseline risk before COVID were about age, country, income, access to healthcare, occupation. So imagine this. What do you expect someone to die on any given day if someone is 5 years old? They live in Germany. They are they are part of an educated, wealthy household. What happens? What do you expect for occupations? For example, loggers are at great risk of dying during their, while they're working. Trash collectors as well. But a politician is at, unless they're assassinated, their job is not very risky, not for their lives. You know that, professors and politicians live very long. These are, and occupational hazard is very low, for example, for academics. To the degree that, it's like 100 times more likely for a logger to die on the job. So their baseline risk is much more different. And when a person works at a job that is already dangerous, when a person lives in a place that's already dangerous for them, where there's constant threat coming from their environment because of disease or lack of security, their perception of risk changes. And this is not because they're dumb, that's because they're smart and they understand what risk they're already carrying and what the added risk, how the added risk changes that. Minority status, that you might be in gender, geographic region, and by that I mean two things. One is internationally, whether you're in the global south, whether you're in a poor country, and also within countries, variations among regions, and particularly between rural and urban regions. Genetic factors, we have no say in them, and health behavior, whether people smoke or drink or take risks about their health. Now, what added risks did COVID-19 bring to people? So this is the most important thing. Age was the open secret when we're talking about COVID-19. The thing that experts refuse to talk about, the things that politicians refuse to engage with, the big thing was age. This is what my presentation is all about, really. If you catch COVID-19, the risk of dying from that, if you're 95, is almost 10,000 times more than when you're 5. I just want you to sit with that information. It's not exactly 10,000, it's like 9,000 something, but so 10,000-fold increase in death rates among COVID patients by age. No one really talked about it that much. They said age increases risks. And of course it does. If you're 95 years old, you're more likely to die of anything. If you're 85 years old, you're more likely to die of anything compared to a 40-year-old or a 20-year-old. So we thought, of course, it's going to be 2, 3, 4, 5 times as likely, 10 times, maybe 100 times. No one imagined 1,000. All the graphs you see are logarithmic. They hide the reality because the reality is, it's pretty insane. It's exponential, especially after the age of 80. It increases so fast. It's it's really not comparable to anything. It's hard to imagine. So the added risk of fatality by COVID for young children over 1 is close to 0. I mean, does it happen? Yes, it happens. Somewhere in the world, somewhere in London, a child dies. But it's so rare that it's not a public health problem. It's an individual tragedy, as opposed to old people, which was a significant public health problem. So, which countries have the youngest populations? The global south. Which countries have the oldest populations? The global north. Now, if we look at that, the median age in Germany is 47.8, which means 50% of the population is under 48 years old, and 50% is above that. In Angola, I specifically changed that to Angola because there seems to be a lot of Angolan academics here. 16. The median age is 16. 50% of the population is under 16. They were not under risk. They were never under risk of dying from COVID-19. And we knew that after about 4 weeks. So I'm not going to talk too much about this, but this is COVID deaths, and red is the worst, and blue, rates, blue is the best. And you see that Africa, it was mostly spared, and that was mostly because of age. The below thing kind of points to that. There are other factors. There was a lot of refusal to believe that, and people said, it's because Africans don't count the real numbers. There is some element of truth that, yes, countries in Europe and North America count everything way better. However, there was also the truth that people could see. So, ratio of the elderly population. Germany, where I live, 22% of the population is over 65. Close to 5% of Germans live in assisted living facilities. In Angola, 2% of the population is over 65, and almost no one lives in assisted living facilities. I'm guessing I couldn't find numbers. So, do you know what percentage of people that died in the United States in the first year of COVID died in assisted living facilities? 38%. If you take that out, almost 40% of people that died from COVID were actually elderly people living in nursing homes. So this was a public health crisis for people living in nursing homes. That was kind of mentioned, that was talked about, but the degree of it was never really discussed. We found elderly people abandoned in nursing homes in several countries. Spain was actually very scandalous. A lot of people refused to go to work, nurses and caretakers to nursing homes. They were underpaid, overworked. They were asked to take risks during a pandemic which was about to bring the end of the world, from what they heard. So what else? Warmer, more temperate climates. That changes the equation quite a bit because you don't want to go to school and be with 40 people, 30 people in the classroom. Well, that's not a problem if you live in a warm, hot country because you can have the class outside. Why close the school when you can just hold a class in the yard? And, oh God, we shouted that. Like in Turkey, we kept saying that. Not all Turkey has the same risk. There are very hot climates in Turkey, and those kids could go to school under any circumstances, regardless of age, whether they're college students or 5 years old, it didn't matter, because they could have their classes outside. And again, which countries had that advantage? The global south for the most part. Use of public transportation, of course, increases risk of contagion in any disease. Living in urban areas for similar reasons, population density. Which countries had population density so those actually increases with poverty usually. Now we have the intergenerational living versus nursing homes. We don't actually know how that affects the general contagion. We know that it's terrible for elderly people to live in nursing homes. When this hit, it was terrible. But we don't know what it means for the contagion. We don't have exact understanding of this. And the population percentage in the formal sector, whatever measures you take, it's much easier to actually have compliance and to follow it and to mitigate anything when you have people in the formal sector as opposed to informal sector, which is very hard to track. Oh God. So, common mitigation measures were curfew, almost everything is closed, including grocery stores, hard lockdown, you're not allowed to leave home except for work and urgent situation. So curfew we saw in India, hard lockdown we saw in Italy, soft lockdown, visiting other households not permitted, congregations not allowed, restaurants, shops closed, but grocery stores are open, people go to work, they're allowed to go out, they don't have to wear masks when they're outside except in public transportation. That was Germany. You could also visit other people, but you could only have one household. There were numbers of people, you can only have 2 guests, 5 guests, depending on the time, but it was never enforced. It was just like, this is the rule. If you don't follow it, it's not like the cops are going to come and arrest you. They didn't. Closing schools, partial lockdown, which we saw in Turkey. Certain segments of the population are subject to lockdowns. People under 20 who were not at risk and who were not risky for other people were locked down at homes. They could not even leave their apartments for 2 months. And also people over 65. Now imagine what kind of effects that has on the young and the elderly. Closing schools, mandatory mask wearing in crowd schools, closed public spaces, and in places like in the States and Turkey, where people were either encouraged or enforced to wear masks when they were outside, just on the street. Where they were shamed because they didn't wear masks when they were alone running, when they were on the beach alone. People were shaming them for not wearing a mask, not understanding the basic, principles of viral infections. So lockdown meant very different things. But you see that those things can be very difficult to enforce and very expensive to enforce. A proper soft lockdown is an expensive thing. But in the global north, they had the resources to actually enforce them. Did not have to resort to curfews or long-term hard lockdowns because they had many tools. For example, the social states immediately stepped in with direct payments to people who lose income because of lockdowns, postponement of electric bills, rent, debt payments, mortgages, unemployment benefits. White-collar workers voluntarily sat at home and worked from home because they had the means. New technologies emerged. I don't know if someone else probably came up with this, but this was the Zoom-demic. I would like to invite you to think if any of these measures would be taken anywhere back in 2000 when we didn't have Zoom, when we didn't have internet everywhere, when white-collar workers could not work from home and they would lose income. So emphasis on keeping the healthcare system rather than, this was very, very important. Local governments had a lot of say in federal countries in the north, like in Germany, in the United States. There were a lot of variations within countries in how the lockdown was enforced. Measures that kept women at home were discussed. I'm not going to say they were not enforced or implemented, but less likely to be implemented, because when 60-70% of women go to work, they're employed formally, you do need to keep the kindergartens open. You do need to keep the schools open. And so in the global south, we see the opposite. If you have to, and we've talked about this a lot, it's kind of imposed by the global north, right? We won't send you tourists, we're not going to give you visas, we won't hold our conference there, we're not going to, give you this or that. There are a lot of ways to encourage countries to follow your lead, but they didn't have either the economic or the organizational capacity, and brute force is cheaper and more attainable. But the elderly lived in multi-generational households. The majority of the population was in the informal sector. Local governments had less power in shaping mitigation strategies, and measures that kept women at home were much more easy to, resort to, because there was less resistance and more women, worked at home. So what is cost-benefit analysis? It depends on the baseline risk, added risk of COVID-19, benefits of mitigation strategies on reducing COVID-19 rates, cost of mitigation strategies on other aspects of life. And that differs so much depending on where you are and who you are. The thing is, these decisions were made by Boris Johnson and Merkel and whoever was, they were all old people in the global north. This lockdown may have reflected their personal anxieties, their social environment. They talked to experts who were also white-collar people who could work from home, whose anxieties reflected their class rather than their ideology or anything else. School closures, the cost of it, loss of years in life expectancy and lifelong income, increased abuse, loss of school protections, forced into labor, marriage, increase in psychological problems, stunting of social skills, loss of academic skills, unsupervised children were at risk of increased accidents, and there were a lot of accidents, risky and harmful behavior, normalization of cheating, weight gain. And curfews, of course, again, I'm not going to repeat because we discuss them so thoroughly. Lockdowns similarly, and I want to add domestic violence and substance abuse due to lack of socialization, psychological problems, avoidance of routine healthcare, and closing of borders, immigrant families divided, inability to see loved ones, plus all the work-related problems. So the discourse and accepted mitigation measures, I just want to, they came up with this discourse of solidarity. We're all in this together. We were not all in this together because we never actually considered that when 7 million people died of COVID, according to confirmed, and in the same time, 2 million people died of malaria. Most of those kids are kids, and they are mostly in Africa. Nobody shows solidarity with those kids, and there are no measures taken to protect them, and it's much cheaper. It's way cheaper. So solidarity discourse is based on perception of universal and equal baseline risk and equal mitigations measures, but that was never the truth. And both the risks of COVID were perceived according to the elites in the global north, and the benefits of lockdown were measured according to the elites of the global north. And who benefited and who lost in the long term? Poor children in the global south are the biggest losers, I would say, and the upper class elderly in the global north are the biggest benefiters of lockdowns. Even in the north, blue-collar workers never stopped working. It was never a real lockdown. About 60% of the population never ever stopped working outside their homes. And the term essential worker, we should discuss this term. It's kind of like suddenly they were essential, which makes me non-essential, which actually is pretty accurate. I'm really ending, I'm sorry. So are we too dumb to understand risks as, like people? Well, sometimes yes, because we're afraid of flashy risks rather than statistical risks. Because we don't, see the common risks like driving, but we're very scared of terrorist attacks, although they're super unlikely. But people develop a generally reasonable understanding of risks in their lives. After a brief period, they realize, okay, there are no kids dying in my community. There aren't that many people, getting too sick in my community. What's going on? Maybe this is not all it's, cracked up to be in certain locations. And in response, what did the governments and experts do? They mystified the process, which is what my paper was supposed to be about. And they said, they talked about risk mitigation. So risk mitigation changed within countries and across countries, and I call it the post-colonialism in management. And these are the mitigation, the dishonest risk communication techniques they used. They overemphasized and underemphasized certain things. They talked about certainty and universality. They talked about they encouraged behavior that was just theater that was proven not to work. I believe that we're now at a worse place than we were before the pandemic. More people are distrustful of scientists and authorities. And we're not ready for the next crisis.